You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell, and welcome to my podcast today, and thank you for joining me. Today I'd like to talk about how to get rid of pesky urinary tract infections. Now, urinary infections are very common in women. Sorry, folks, but they are. They're even more common in menopausal women. Today I'd like to talk about why that is and how to prevent and monitor for urinary tract infections and why it is extremely important. When the ovaries hit the time of retirement, many tissues which have estrogen receptors suffer. Genital and urinary tract structures are hit hard when they lack estrogen. Why is this? Estrogen makes the cells that line the urinary tract and vaginal area healthy. A healthy cell is protected against invasion by bad bacteria. When cells lack estrogen, they become dry, irritated, and easily susceptible to infections. So if a woman has a history of repeated urinary infections before she gets to menopause, they are even more susceptible to infections when they are in menopause. Even if a menopausal woman takes estrogen in a patch or gel applied to her skin, she may not have an adequate leftover estrogen to satisfy the needs of the urinary genital area. Some women advise me that they need not worry about this area as they are not sexually active anymore. I've heard this story several times, by the way. Unfortunately, if any tissues are dysfunctional, they may wreak havoc with the body in a number of ways. Let's look at a frequent scenario. A menopausal woman is having fatigue chronically. It doesn't matter how much sleep she seems to get. She's also noted difficulty with memory. She wonders if she's losing her mind. A common cause of these symptoms is a bladder infection. Unfortunately, many doctors do not even bother to check a urine sample for patients. A urine specimen can tell so much. It's not only checks for infections, but also for kidney function, diabetes, as well as other conditions. The first line to realize is that lack of estrogen, whether women are on systemic estrogen or not, affects the health of the bladder, urethra, and vagina. Whether the patient is sexually active does not matter. Their health in fighting a chronic infection that may drain their immune system and energy, as well as manifesting in mental dysfunction, is of utmost importance. I always check urine in the annual checkup for patients. It's important for women to realize that they are at an increased risk. I recommend reversing vaginal dryness regardless of sexual function. Sexual dysfunction may have occurred due to pain on intercourse, and that can be reversed with treatment. Vaginal dryness can be treated with several forms of estrogen directly. It needs to be treated directly. There's estrogen creams, vaginal rings, and suppositories. Testosterone is also helpful, particularly for external genital dryness in the proximal vaginal area. It is also very helpful for urinary leakage. One of my patients advised me after using testosterone, her leakage resolved. She states it had been going on since the birth of her daughter 19 years ago. Testosterone is available in a compounded form, either in a cream or a suppository. And we do not treat this area, which is very important, enough. The hormones systemically that are administered just simply are not enough to treat genital problems, and so we must directly treat this area. I'd like to also mention preventative measures if you have a history of urinary tract disorders, infections, and that is taking mannose daily. Now, mannose is a sugar, but it's a sugar that we can't use. So therefore, it doesn't get absorbed. As a matter of fact, it gets eliminated. So it just goes through our system, but on the way out, it goes through urine to be eliminated. And the bacteria that is most common in causing urinary tract infections loves mannose. And when it sees mannose going through in the urine, it jumps on the mannose molecules like Velcro strip. It just sticks on. And then it is totally eliminated. So if you are taking mannose daily, you are eliminating it. We're not using it for anything. But the bacteria that can hurt you love it and will be eliminated, and you will be protected. Pretty cool. I always recommend for women who've had urinary tract infections to monitor their own urinary output. They can get urinary dipsticks at any drugstore. They don't need a prescription or anything like that, but if they want a prescription and want to try and run it through their insurance, I'm happy to provide this. All they have to do is get a clean cup, get a urine sample, dip it in, check once a week or so. Just make sure that dipstick can tell them if an infection is going on. And if it's not, great, they're doing a good job. But if it is, sometimes women can't identify it, especially menopausal women. So that is the time to treat. So I hope you found this somewhat informative. Please stay tuned for the next podcast. We love your questions and participation. Take care and have a great and healthy day.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.